Good day, sir. Today, I'm gonna show you how will I perform the return demonstration of assessment of the thorax and lungs. Before proceeding to the procedure, I will first show you all the necessary equipment that I'll be using throughout the assessment. First, I have here the alcohol, the stethoscope, the marker, and the ruler. Now, I will introduce myself to the patient and verify his identity. Good morning, sir. My name is Rhea Hernandez and I will be your nurse for today. May I know your name, please?
I'm Jan with dementia.
Okay. May I, ano po gusto niyo itawag ko sa
Jan with dementia.
Okay. Mr. Danby, are you aware that I will be assessing your lungs and thorax? Okay. There will be times that I will touch some of your body parts. Is it okay with you? May I know if you have any history of respiratory illness like asthma, bronchitis,
Yeah.
you have cough, you experience chest pain or difficulties breathing? Okay, alright. So now, I would also like to inform you that all the information and data that I will be gathered throughout the assessment will be confidential and private. Okay? Before doing the procedure, I will first sanitize my hands. After sanitizing my hands, I will proceed with the first step. Now we will be focusing to the posterior thorax.
After assisting my patient on his sitting position, I ask him to breathe normally. I observe the breathing pattern and assess for the stereoposterior and transverse diameter of the chest. He has a normal breathing pattern and the chest is bilaterally symmetrical without undue elevation or depression. The anteroposterior's transverse diameter is also as a ratio of 5:7. The next thing that I will do is to palpate the spinous process. While palpating it, I found that there is no deformity or tenderness during the palpation. After that, I assess for symmetrical chest expansion. After I assess him, he has a chest expansion of 2 to 5 centimeters. Now I will assess for tactile fremitus as the patient repeats the phrase 99. After assessing, I found that there is no any fremitus. Next is to perform the systematic percussion where I will use my middle finger. Upon percussing it, I found that there were no abnormal sounds when I did the percussion. After that, I assessed for diaphragmatic excursion. I measured the distance between the set of marks I made in each side while assessing for diaphragmatic excursion. By measuring it using the marker and the ruler, it ranges from 3 to 5 centimeters, which is normal. For the next step, I instruct my patient to breathe deeply and fully with his mouth when I perform the auscultation technique. Here, I will use my stethoscope. For the findings, there are no abnormal breath sounds elicited during the auscultation. The next thing that I will auscultate is the breath sounds using the diaphragm of my stethoscope. The auscultation method should move systematically, comparing lung sound from side to side down the patient's back. While palpating it, there is a loud, high-pitched bronchial breath sounds over the trachea, which seems to be normal. In this part, I will be proceeding to the auscultation for bronchophony. In this, I instruct my patient to say the phrase 99 while I am auscultating his posterior thorax. Upon palpating it, the sound of the patient's voice becomes less distinct. After the bronchophony, I will proceed to the egophony, wherein I instruct my patient to say the phrase E. During the auscultation, it sounds muffled. When the patient say E, it changes to I sound. The egophony seems to be normal. The next thing to identify is the pectorology, which I instruct my patient to whisper 1, 2, 3. Upon auscultating, the whispered sound are clear and distinct. All done. We will now move on to the anterior thorax. Here, I will begin with the bones and muscles, and I will also identify the breathing pattern. Upon observing, there is no use of accessory muscles. Chest is symmetrical and breathing is seemed to be normal. Next, I will palpate the thorax with my finger pads and assess for nodules. Upon palpating the thorax, there is no pain or tenderness during the palpation. There is no presence of nodules or any abnormalities. Now, I will place my hand on the chest of the patient along the costal margins, linking my thumbs on the xiphoid process to assess the respiratory excursion, then instruct the patient to breathe deeply. Upon doing it, the exhalation is symmetrical in both right and left. Next is to assess for tactile premitus by letting the patient to state phrase 99. The tactile premitus is normally found over the mainstream of bronchi near the clavicles. Now let's proceed to the percussion over the lungs starting from the clavicle. In here, I observed that the sound became dull when it came to the heart and liver. Next is to auscultate the trachea. Here, I will be using my stethoscope. While auscultating the trachea, I observed that it has a loud, high-pitched bronchial breath sounds over the trachea. And then I assessed the lungs using the auscultation method also. Upon auscultating the lungs, I don't hear any abnormalities on how it sounds. After assessing the posterior and anterior thorax, I sanitize again my hands and thank the patient for his full cooperation throughout the assessment. I document all the findings and proceed to the discussion. That would be all. Thank you very much. Keep safe and God bless.